Massive trauma as a result of COVID-19. That's according to the International Council of Nurses, which has gathered new evidence of mass trauma being faced by nurses who are on the front lines, as you know, in the fight against the coronavirus. The ICN released its findings this morning, and to talk to us more about this is ICN CEO Catton. Howard, always a pleasure having you on the program. Welcome.
Good morning. Good to talk to you too.
So break down this new evidence that the International Council of Nurses says it has gathered, suggesting that COVID-19 is causing this mass trauma among the world's nurses.
So we know that the pressure that nurses, the health workforce, has been under around the world has been relentless and unprecedented. What we're now seeing from many countries are stress and anxiety symptoms being reported at 80-90%, increases in sickness and in burnout, 10-15% plus. Also nurses who are quitting right now. We've also having reports of nurses who are fearful of going to work. Sometimes that's still to do with the lack of PPE, the higher risk and not having the equipment. Sadly, some cases of suicides being reported, and we now know that more than 2,200 nurses in 59 countries have died as a result of contracting coronavirus. And that's why we're saying that this is a global phenomena resulting in this mass trauma of the nursing workforce.
Let's just dig a little deeper. Just looking at the numbers around the world currently, looking after COVID patients involved, I guess it involves dealing with an increased number of fatalities. You hear about nurses having to stand in for relatives who are not able to be with their loved ones at the very end, even, you know, as they're dying. Talk to us, Howard, about the psychological distress that overstretched staff are experiencing.
You're right. This is complex. There's this increased intensity of work. Nurses who their workload has, some cases it's tripled or quadrupled, and the ratios between patients and nurses in ICU having gone from 1-to-1 to 1-to-4 or to 1-to-5, having to provide the psychological support to patients, as you say, because relatives aren't there as well. But then on top of that, in many countries, examples of abuse, of victimization, physical as well as verbal abuse, public who are fearful that nurses are spreading the disease. And then on top of that, we've also got these flat earther COVID deniers saying the whole thing's a hoax. Imagine you go to work, you put yourself at risk, you make that sacrifice, and then you hear that. And it's this combination of all of these factors which add to the trauma, the distress that our nurses are facing.
I want to talk about something that you refer to as the COVID-19 effect. Your statement refers to it as a unique and complex form of trauma which potentially devastating consequences for nurses and healthcare systems. Talk to us about both the short-term and the long-term consequences of this COVID effect.
So we went into this pandemic globally in the region of 10 million nurses short, and also with nurses who are going to be retiring as well. If there's an impact of the COVID effect, we have more nurses leave through sickness or through that they've just had enough of the job because of the experience they've been through. That could bump the number of nurses that we need to replace around the world to perhaps 13 or 14 million in the next few years. We have 27, 28 million nurses around the world. So this is half the nursing workforce that we are talking about. And we all know that nurses, health workers are the backbone of our health systems. No nurses, no health care. When we get through COVID, we've got all of the other conditions still to deal with, to look after, the cancers, the non-communicable diseases. The world leaders have an ambition to increase access to health care for everyone, rightly so. But we're not going to do that if we haven't got more nurses. So why we need to invest desperately in our nursing workforce.
So Howard, just give us a global snapshot of the COVID-19 effect. What have you found, especially here in Africa?
So the studies that we've seen in Africa have included increased reports of symptoms of anxiety, of stress, of some depression as well. We see nurses who are absolutely committed to their patients, to their work, to their job, but are saying things like, I think I'm getting to a breaking point. I just don't think that I can do this anymore. Families who are very, very worried and concerned about their relatives who are nurses and healthcare workers. Sometimes, some examples already of post-traumatic stress syndrome, and this is a worry as well because we're talking about fairly short-term impacts. Post-traumatic stress syndrome, nurses who get long COVID, these are issues that will impact on nurses for the medium and the longer term as well. And I fear that I think that very, very many nurses will do as much as they possibly can to get through COVID. But it may be at the end of that they say, I'm done. I was going to do another 3, 4, 5 years, but I'm done as a result of this as well. And that's why the immediate support that we all need to give to nurses now, as well as the long-term investment, and for members of the public, this isn't just about people who work in health systems, members of the public, the best thing we can do is to stop this virus. And that means comply with the rules in your country, distance, stay at home, mask. If we all do those things, we are helping our nurses and our healthcare systems.
And it seems like a simple request, but many would say easier said than done. Howard, on the program today, we're talking about stigma and discrimination directed at those who contract COVID-19. What's your level of concern regarding social stigma associated with COVID-19 as it relates to medical professionals?
Again, it's a very real issue in many countries around the world. We've had examples of nurses coming off shift in European countries and being shouted at, being abused. We've had examples of where media have been reporting outside a hospital and public have been shouting it's a hoax, it's not true. We've had examples of nurses who have been unable to renew their tenancy agreement for their apartment or their house because their landlords are worried about whether they will spread the virus. Nurses who've had difficulties accessing childcare and 90% female population, it's hugely important that support is available for people to go to work. Some of this may be ignorance, lack of information, but we need to, where we see examples of abuse, victimization, we need a zero tolerance approach. Everybody needs to call that out as being abhorrent and wrong. And we need to deal firmly with the deniers of COVID. This is real, and it's nurses and health workers who are dealing with the consequences every day they go to work. And
the consequences, we can list it: physical exhaustion, mental health pressures, all of these contribute to what nurses are going through. And I guess it's so important to bring it to the fore so that we can get better as a nation and get to a better place as a country. Howard, we thank you very much indeed for your time. Best of health to you and your family during these uncertain times. Be well.
And you too. Thank you very much.
All right. Howard Catton there from ICN. Look, coping with COVID-19 seems to have this endless challenges, isn't it? The tragedy of losing loved ones, loss of livelihood, isolation. In many cases, people are in confined spaces, often leading to bitter arguments between spouses and partners, even domestic violence, anxiety and depression. They have taken a toll on many, many families, as though